Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about menopause and mental health is Dr. Joy L. Ballard. Dr. Ballard is a board-certified obstetrician and gynecologist who uplifts women daily in her office to assist them in taking a proactive approach to their health. She is very passionate about educating and empowering women to initiate and maintain a healthy lifestyle. She is a best-selling author of Loving Me, Myself, and Her through Perimenopause and Beyond, which is a self-affirming guide that enlightens, encourages, and empowers women approaching the menopausal transition. Dr. Ballard is a speaker who aims to provide a platform for women in the community to become educated and invigorated about facing different aspects of their health. How are you doing today, Dr. Ballard?
I am fine, Jason. Thank you so much for having me today.
Yeah, well, no, correction here. Have you back? I don't know if I told you this. So the podcast that we did back in June, Perimenopause, The Journey to Menopause, has been our most downloaded podcast. So
Really?
we need to get people, we'll talk about the podcast at the very end, but that, needless to say, the information that you are providing has been very worthwhile. So I'm looking forward to today. So let's get going. Your
Awesome.
menopause, your mental health during menopause.
Yes, awesome. That is great to hear because definitely your mental health during menopause is so important because these are really the symptoms that women are really caught off guard by. They're really surprised by. My 55-year-old menopausal woman who has a very short temper or short fuse with her husband. My 45-year-old perimenopausal woman who have short fuses with their kids, and they really feel bad about it, but they can't control it. They don't know what's going on, so they're really caught off guard by what they're doing as far as their mood and their tempers, and it's really out of character for them. So I'm really excited about talking about your mental health. So just a little definition. At the objective wise, we're going to talk about mental health changes that you experience in perimenopause and menopause to learn which mood disorders can worsen during perimenopause and menopause, learn the difference between brain fog and dementia, and we're going to learn about natural remedies or coping skills to improve your mental health. And we're going to also talk about eliminating the fear or the stigma of taking some antidepressants. So before going to all of that, I wanted to clarify perimenopause versus menopause. Perimenopause, peri meaning around menopause, can start as early as the age of 39. And that is when your hormones are fluctuating and you are potentially still having periods. They can be regular periods or irregular periods, but you can start to have symptoms of menopause at this point, as opposed to menopause, which typically is defined by the absence of a period for 12 consecutive months. And that the average age of that is about 51. And you can also start to have menopausal symptoms at this point, or you can have a continuance of symptoms from your perimenopausal experience. So that's the difference between perimenopause and menopause. So what's happening, this diagram is showing, I don't know if you, hopefully you can see my little arrow here. So yes. Your estradiol is the most potent form of estrogen in your system. And this is kind of a diagram of the life cycle, the stages of womanhood. And you can see here in puberty where the fluctuations of estrogen is kind of, up and down here. And then as you in the premenopausal stage, things are kind of steady. Your estradiol is steady, your progesterone is kind of steady. And then you reach perimenopause, and that's where it goes crazy. You see the fluctuations happening again, more dramatic, more intense. And that's why a lot of women will complain like, why do I feel like I'm a teenager again? And this is why. You can see it comparatively to puberty, even though it's more intense during perimenopause, but that is what's happening. These your fluctuations of your estradiol, your estrogen is happening, and that is what's causing these symptoms that are kind of, listed on the side here. And most women or most people in general associate menopause with just hot flashes. But, we're talking about mental health changes today, which, like I say, a lot of people are really surprised about. So what kind of mental health changes can we experience? Mood, irritability. I talked about short-tempered or short fuse, angry outbursts. And again, like women are like totally aback, they like, why is this happening? They can also feel like they are just up and down the emotional roller coaster. There can be times where they're feeling happy and fine, and then within an hour or a few hours, they're sad, or they feel down. So you can have these mood swings that are either new, or you can have a history of mood swings that's been worsening. So you can experience that too. Or you can have crying for no reason, which also is, can be something that's, distressing. We can be, watching television, and you can all of a sudden, see a commercial or something, and you just start crying for no reason. And you really feel like what is going on? And it really is not in your control, like, because your hormones are just kind of all over the place. You really can get distressed because these emotions are coming on, and you can't really control it. So you really can be distressed about it. And even your family is like, look at you like, what's wrong? Like, like you feel crazy, your family or your significant others looking at you like you're crazy. So these changes can be, like I said, very distressing, and just, when you're not really expecting them. So that's why it's important that you know what you could potentially expect. And every woman is different. Changes in general with menopause. There's some women who get no symptoms whatsoever. Those are the lucky ones. And then there are some women who can have one or two of these symptoms. And there's others who can have a slew of them, like, multiple symptoms. So everyone's journey is different, but it's good to kind of know what to expect. So again, with the mental health changes, you can have worsening mood swings or PMS, the ups and downs, crying for no reason, anger, and depression is another one. So you can have new feelings of anxiety or worsening anxiety if you have a history of anxiety, and that can be nervousness, panic, or worry. And then you can also have depression, or a new diagnosis of depression. So clinical depression, there's different categories of depression. So actual clinical depression was a clinical diagnosis that we actually you have to meet criteria for. And that essentially is 5 or more symptoms that are present during a 2-week period. And one of these symptoms have to include either depressed mood or a loss of interest or pleasure in all activities. And then the rest can, again, be fatigue or loss of energy nearly every day, too much sleep or lack of sleep every day, some type of agitation, or just agitated, which is really observed by either your family or just others in your circle, feelings of worthlessness or inappropriate guilt nearly every day, diminished ability to think or concentrate, or just indecisiveness, or recurrent thoughts of death or thoughts of committing suicide with or without plan. And especially that last one, if you have any of those type of things, it's really important that you seek out medical attention with your primary care doctor or your gynecologist. But these are essentially the criteria that we go by to diagnose someone with a clinical depression, as opposed to depressed mood. So if you have diagnosis of history of depression in the past, so before the menopausal transition, you can be at risk of having that depression either worsen, or if you had it before and it kind of improved and you've been fine, it can kind of come back and require that you may potentially go back on the medication for it. So if you have a history of depression, clinically diagnosed, or anxiety, the potential for that to come back is higher with the menopausal transition. If you have a history of premenstrual syndrome or PMS, that's when you have the mood swings, as well as physical symptoms like bloating and breast tenderness that happens anywhere from 7 to 10 days before your period. You can be at risk of having depression during the menopausal transition. Or if you have a history of premenstrual dysphoric disorder, PMDD, that's essentially kind of a grade up above PMS, because it has the same symptoms of PMS, but you also have a diagnosis of anxiety and depression at the same time. So, and then also if you have a history of postpartum depression, you can also be at risk of developing depression during the menopausal transition. So keep those in mind. So if you have any of those, in your history, you can kind of, be aware that they potentially can put you at risk of having depression during the menopausal transition or during perimenopause. And like I mentioned before, there's different categories of depression that we, kind of look at. So you can have a depressed mood, which is more kind of a brief period where you feel kind of down, and you're able to kind of pick yourself back up and you're okay. Or you can have depression due to, a reaction from something. So whether it's divorce or a death of a loved one or a diagnosis of a medical illness like cancer, like you can develop, depression or depressive symptoms from those type of life-turning events. Clinical depression, I just mentioned the criteria that we essentially go by. We look at those to see if you actually meet the criteria for clinical depression. And then there's dysthymia, and that's essentially a chronic depressive disorder where you have depressive symptoms most days for at least 2 years. And this is kind of difficult to diagnose sometimes because it happens over a long period of time. So you may or may not kind of notice it because it kind of goes in a steady rate. But it's more of a chronic condition as opposed to something more acute. So those are kind of the different modes of depression that we kind of look at to see which category you may fit in based on your symptoms and how often your symptoms are coming, whether it's, every other day, every day, every couple of weeks, just kind of, based off of that. So then, besides mood, you can also be someone who can describe something like brain fog. Like you can't remember, you forget your keys, or you can't remember where you put your keys, or you are having conversation and you forget the word you were going to say, then you ultimately remember it, but you just feel kind of foggy. Or you're doing something either at work or at home and you feel like you're losing concentration. So a brain fog is actually also common, related to the mental health changes with perimenopause and menopause, because estrogen or estradiol also has some influence on our brain neurotransmitters that influence our concentration, our memory, our mood. So during that transition, if your hormone, your estrogen is, fluctuating, and then ultimately decreasing, that can affect those brain functions. So you can experience this brain fog, which again can also be a little scary when you're used to be this sharp person and everything, and then all of a sudden you're forgetting or you can't concentrate. And some women can be afraid of it, like my experience in dementia, like what is this? So, but there's different differences between brain fog and things like Alzheimer's, which is a most common form of dementia. So like I mentioned, brain fog is more of something that, you forget something, but it ultimately comes back to you. Alzheimer's, this is more of a progressive thing, like you're forgetting like major events, major dates, you're not remembering. Brain fog is more temporary. Alzheimer's, it progresses, like it continues on. It doesn't, it doesn't stop and get better. It progresses. I mentioned, losing words in the conversation. Alzheimer's, you can't even follow the conversation. Like you forget where the conversation was going or what you were talking about. And the other big thing with Alzheimer's is that you actually lose interest in social engagement, like you withdraw from social events or just social engagement. So that's the big thing with Alzheimer's, because your personality is just becoming so different with the dementia. It pulls you away socially. So that's the difference between, brain fog. Brain fog, you can still function on your day-to-day basis. Alzheimer's or dementia, it's affecting your daily function. So that's kind of something to kind of look at, if you get concerned if you have a little bit of brain fog. It is something that you still are able to function daily, as opposed to Alzheimer's, you may not. And also try to reassure my patients that, with brain fog, it is, very frustrating at times, but it typically is temporary. It can last for, a few months, maybe even a year, which sounds like forever. But it typically does, it does improve over time. It's not like, again, it's not like dementia where it progresses and gets worse normally, especially if you do things that kind of help promote and improve your brain health. So what other things can you think of that affects our mental health? You know, as women, we are so busy taking care of everybody else, right? And we have so many things on our plate. There are so many other things besides our hormones that can affect our mental health. And a big thing is stress. You know, we wear so many hats as women. So stress is a big thing, and there's so many different stressors that we can encounter. You know, as we're getting older, our body image may change because we gain some weight, and that affects our self-esteem. That puts stress on us. That affects our mood. Our personal or family medical problems, so we're stressed about that. Divorce or losing your significant other. That's, you know, can be very stressful. It can cause you, I mentioned depression due to a reactionary event. So that can potentially kind of put you in that category. If you're caring for your young children, like myself, I have 3 kids, that can be stressful. Teenagers, mine are not teenagers yet, but teenagers can be very frustrating and, you know, distressing. Or you have grown children who've left the nest and they've come back. And they brought people with them, their husband or their children. That can be stressful. Or you're concerned about your aging parents, and that you can get into the sandwich generation where you're actually taking care of your children and your parents. That can be a lot of stress, which can ultimately affect your mood. And then, you know, a lot of times women, especially in our midlife years, are making major career moves or, you know, career changes, and that can also be very stressful. Or our relationship in general with our partners, you know, whether, you know, you're going through problems in the marriage or, you know, either a divorce or separation. All those things are major stressors that can affect our mood and ultimately how we react and respond to the hormonal changes that leads us to the menopausal transition. I mentioned depression. Our sexual appetites can change as we get older, and, you know, a decreased libido, you know, our sexual health is very important and very influential on our emotional and mental physical well-being. So if we have a decreased libido, that can be very distressing if we're used to, you know, being a sexual person, and then that kind of goes to the wayside, and that affects you and affects your relationship. So that can also be, you know, again, another stressor on your mental health. And then aging in general, you know, as we age, it's very normal for us to have some mild memory loss, and that's just with aging, and that's just, you know, something that happens. And sleep deprivation, that's a big one. Sleep deprivation definitely can affect our mood. It can make us very irritable. It can also affect our cognition or our brain function. If we're not getting enough sleep, you know, you can't be surprised when you're not able to concentrate the very next day because of that lack of sleep. And then vitamin deficiencies, particularly vitamin B6 and B12 can essentially have some influence on your mental health. So be aware of that too. So what can we do about it? So the first thing is look at your diet. I really try to promote the importance of eating the rainbow. Like, you want to look down at your plate and you want to see a rainbow of colors, because a very nutritional, nutrient-dense diet can play a big part in managing your mental and your brain health, and particularly your gut health. So serotonin is one of the transmitters that is our natural mood stabilizer. And over 80% of that is produced in our gut. So if our gut health is out of whack, like if it's not in balance because your diet is poor, then your production of your serotonin is also going to be poor, which ultimately can affect your mood. So eating a healthy, nutritious diet makes a big difference. I usually try to recommend going towards a plant-based diet. You know, a lot of dark leafy green vegetables. You also want to get in your fruits that have very high antioxidants, like blueberries and things like that. So you want to really try to put things on your plate that is going to be very colorful and very nutritious, because that definitely fuels your brain cells. exercise. You have to move. Studies have actually shown that consistent exercise can help improve your brain health, especially as you get older. So you really want to make a point to have consistent exercise and do something that you like to do. Now, I don't like running, period. And I don't like running on the treadmill. And I found that when I was trying to do that, I didn't really want to exercise. So I got into spinning, which I love, which makes me more motivated to exercise. So you have to find something that you like to do. So that would actually kind of keep you accountable and also make you more consistent. And I also want you to look at exercise, because a lot of times as women, we look at exercise, oh, I have to exercise to lose weight. Yeah, that's true. However, it's also good to maintain, not only maintaining your weight, but maintaining your heart health, and also maintain, like I said, your brain health. Like I said, the studies have shown that consistent exercise can help with your brain health. So think of it that way, as another motivator, like not just to lose weight, but actually maintain other body systems that are very important to your health as you're getting older. So you want to do your aerobics, you want to do your strength training, and light weights. And you want to get to the goal of 30 minutes a day for at least 5 days a week. Now, I know, sometimes we are so busy, but we have to carve it in our day some kind of way. And if you can't do a full 30 minutes at one time, do 15-minute increments. Or if 30 minutes is too much initially, if you're just starting out, start at 15 minutes and then work your way up. Do 20 minutes the next time, and then 25, and then 30. So, just kind of work within your schedule. Whether you have to wake up in the morning, a half an hour earlier, versus if you have to, take time in the evening time, take 15, 20 minutes away to kind of do some type of exercise, put it in your schedule so it can be part of your routine. And sex counts. Like I mentioned sexual health before. Sex, you lose a couple calories. It's also good for natural immunity, and it relieves stress. I mentioned how big stress plays a part in our mental, health in general. A good sexual health can certainly be helpful in regards to improving that. Social engagement. Please stay socially engaged. Now, I know we're in the middle of a pandemic still, but we need to, take advantage of, technology, whether it's FaceTime on your phone or, Zoom calls, things like this, to kind of keep yourself socially engaged with your friends and your family, because that makes a big difference. Social engagement, just interacting with, your family and friends, again, helps just keep your brain going. So you definitely want to stay socially engaged in regards to that. And sleep. I mentioned the detriment of the lack of sleep. It's really so important. A restorative sleep makes a big difference. It is important for our physical, brain, and mental health. There are 5 stages of sleep, from non-REM to REM, which is rapid eye movement, which is our dream state. And you have to get through the first 4 stages in order for it to be restorative sleep, because this is when the brain is repairing, it's growing new cells, it's allowing nerves to regenerate. So you really have to get through those 4 stages to actually get good restorative sleep, because some of this repairing and regeneration involves something called telomeres. And these are little pieces of DNA that lives at the ends of our chromosomes, and it actually acts like a plastic end on a shoelace. And as we age, these telomeres wear down and get shorter over our lifetime. And with that, when that happens, it decreases their ability to protect our cells, and then less new cells can replace the old cells. So if you get a good restorative sleep, these telomeres are able to act appropriately in order to maintain, the old cell, as well as regenerate new cells. So I usually recommend 7 to 8 hours of sleep, which I know I'm still personally working on myself. But, as you know, menopause, just in general, perimenopause can have other symptoms, hot flashes and things like that, night sweats that can interfere with your sleep. So if you're having things like that or any other things that are interfering with your sleep, you want to talk to your physician or healthcare provider about what you can do about taking care of those things to be able to help improve your sleep. So just kind of, keep that in mind too. Yoga and deep breathing is also very important. Just being able to sit still and giving yourself, time to collect your thoughts and just kind of meditate is also very helpful in regards to your mental health. And, natural remedies, like I mentioned, healthy diet, exercise, vitamin B6, vitamin D can also be helpful, supplemented with those. Ashwagandha is a herb that is essentially we call it adaptogen that helps us adapt or basically react well to stress. So taking a supplement of ashwagandha can be helpful. And it's a wide range of how many milligrams, anywhere from 250 milligrams to 5 grams a day. But it really kind of, I usually recommend starting off with a low dose and kind of working your way up if you need to. And then St. John's wort is another herb that has been shown to be beneficial in helping with depression. And the recommendation for that is usually anywhere from 900 to 1800 milligrams a day. And again, with all these supplements, it's really important to talk to your physician about what you're thinking about using, because some of these supplements can interfere with medications that you're on or with medical illnesses that you may have. So you want to really talk to your physician first before you start any supplement, just to make sure that you are taking something that's not going to interfere with what you're already taking. The other supplement that you may have either heard of is S-adenosylmethionine, or SAMe. That's actually is another transmitter that is produced naturally in our body, and actually vitamin B6 and vitamin B12 plays a role in that pathway, and that has been shown to aid in improving depression. And anywhere from 200 to 800 milligrams a day can potentially help with that. So again, with all these supplements, these are something that you can potentially try that may help with a depressed mood, or just feeling kind of moody or mood swings and things like that. You can potentially talk to your physician about using some of those things. And then antidepressants, I want to definitely get across that is okay to take if that's what you need. I think a lot of times, obviously if you have a history of depression or even anxiety and you were on medications before, a lot of times I would say we may need to put you back on something if the depression and anxiety is really affecting your daily function. But if you don't have a history of it and you develop this depression or anxiety, it is okay to be on an antidepressant if that's something that you need. I think a lot of times women are hesitant on going that route because, number one, they don't want to have the stigma of being on an antidepressant, and number two, they feel like they will never get off of it, which may not be true. There are times where you can be on these medications and it can be only temporary. You can be on it for 3 months, you can be on it for 6 months, and then wean yourself off and see how you do, because in that, while you take the medication, you can do other things naturally to kind of help boost and improve your mood at the same time. And then when you decide to get off of it, you'll be able to cope with these, with these feelings. So it is, if it's something that you need, I definitely recommend that you go that route, as a temporary thing at least, and then kind of see how you do after the fact. And then also psychotherapy, a talk therapy is really good to have a objective ear to listen to your feelings, your issues at this time too, if you need that. And that's also very beneficial. So either doing that first and then after that, see if you need medication, versus doing the both at the same time, talk therapy and medications. It really kind of, depends. And again, even with the antidepressants, these can also interfere with other things that you may be taking. My patients with breast cancer who are on tamoxifen, so certain antidepressants can affect the actual effects of tamoxifen. So it's very important to talk to your physician, what the interactions may be with other medications that you are taking. And then what about hormones? Women a lot of times they wonder, like, okay, what if I just go on hormone replacement therapy? Is that going to fix me? Well, if you're perimenopausal, with mood swings, there are times I've placed women back on birth control pills to kind of help with that. If you're menopausal, Hormone replacement therapy, essentially, if you are having other symptoms like hot flashes, night sweats, things like that, hormone replacement therapy has been shown to be helpful with your mental state because it's taking care of the other symptoms like the hot flashes and the night sweats and things like that. But if you don't have any of those other menopausal symptoms and you just have this mental, whether depression or anxiety, the studies really haven't been supportive in regards to using HRT just for that reason. So usually it's only beneficial if you're also experiencing other menopausal symptoms at the same time, that it may be helpful in that. And also be aware that if you are on HRT after the age of 65, it actually can put you at risk of developing things like dementia, in the long term. So that's a lot of times we don't recommend being on HRT for prolonged period of time. So be aware of that too. So just kind of recap. Sleep is so important. Exercise, meditation, yoga, just kind of relieve stress. Mindfulness, talk therapy, getting your vitamins in, either through supplements or through your diet. Taking medications if you need to, prescribed, and I mentioned birth control pills potentially for that perimenopausal woman. And it's really all about, trying to maintain a balance. Like, you want to maintain a balance of what you are putting in your body physically by eating. Food is the best medicine. And you want to be mindful of what you're putting in your mind. You want to put things in your body and your mind that is serving you well. So a good, healthy nutrition diet, reading affirmations, things like that. You want to kind of produce some type of balance so you can actually manage through these mental changes through this transition. And what are self-care is really, a big thing. And all this really embodies self-care. This is really you putting yourself first in regards to, doing the things you need to do to make yourself feel, and, essentially overall, what are you putting in your cup every day? Are you filling your cup every day? Or are you running on an empty cup? So you want to really have a goal to fill your cup with, peace, gratitude, relaxation, whatever, that, gives you joy. You want to fill that cup with those things, because that's what's going to keep you managing, what you're going through as you're going through this transition. So I want to end with this quote: "We are not perfect human beings, nor do we have to pretend to be. But it is necessary for us to be the best version of ourselves we can be." So this is my mood in 24 hours. I personally started perimenopause at the age of 39. I'm now in my mid-40s. And, I am going through the same journey, ladies. I have been through, the irritability, the silliness, the craziness, and the happy moments. These are my 3 kids. And I just want to let you know that I am, walking right beside you through this journey through perimenopause and menopause. Thank you very much. So if you have any questions, I'll be happy to answer them.
Excellent stuff, Dr. Ballard. A couple different questions. The first one: are the mental health changes permanent, or will somebody return to what they consider their normal self?
Great question. So typically they are usually temporary. I mean, especially with the more cognition things in regards to brain fog, concentration, things like that, those typically can come back. Will they come back to a complete, normal? Now, again, like I mentioned before, as we age, it's very normal for us to have, changes in regards to our memory and concentration. That's the part of normal aging. So it may not go to your, complete baseline, but it can certainly go back towards, close to it. And that also would move too, again, as you're kind of doing things that will help you improve these mental changes, you can potentially go back to close to your baseline over time.
I want to talk about family history. So when I say family history, speaking specifically to if you had a family member that had some of this mental health changes that was just during the menopausal period, but it was a temporary thing, it wasn't a permanent thing. Is that something somebody should say, oh, well, if my mom or my grandma had that I'm going to have that too?
Yeah, the mental health, the mental, new depression during menopause typically doesn't kind of pass down into family normally.
Okay.
Is it possible? It's possible, even with hot flashes. Some women, mom who had hot flashes, may not get hot flashes during menopause, or they might. So it's not something that definitely is a direct connection. I mean, it's definitely good to know, just to for your own information, that may be a potential thing, but it's not a guarantee that you'll actually have the same thing happen to you.
Okay. Last question, Dr. Ballard. Obviously, we're in unprecedented times with COVID. How do
Right.
you balance when you're diagnosing a patient with potential mental changes from COVID and or potential mental changes from menopause? What does that look like for you as a doctor?
Ooh, that's a great question. Yeah, I mean, like you said, the pandemic in general. I mean, I talk about stressors. I mean, the pandemic is the big stress of all, right, for everybody. So if you have that and then you are going through menopause, that's really tough. And I think I would still have, you know, probably the similar approach to, definitely, looking at your diet, looking at your exercise. And, you're also limited because, some of the gyms are closed. So, a lot of women are not able to get out. And we really have to, pivot and readjust of what, talk about things we can do at home, whether it's going out, for a walk, doing exercises in your home. And then, with the, if it's more depression and anxiety, making you have connections if you need to with therapists, whether it's through telemedicine, things like that. So just kind of finding different avenues of, based on what you need, and providing you resources with access to those things, so you won't, so it won't spiral into something worse. But you may have to kind of, work around different things just based on what your symptoms are.
Very good. Well, Dr. Ballard, how can people find you?
Well, you can find me on social media, Facebook, Instagram, Dr. Joyelle. You can also visit my website, drjoyelle.com. You can also, on my website, purchase my book, Loving Me, Myself, and Her, through Perimenopause Beyond. Just go to the website and purchase there.
Very good. Well, Dr. Ballard, wonderful stuff. It's good to have you back. So this webinar today will be on YouTube. So you can find us on YouTube. Go into YouTube, type in Knowledgeable Aging. I encourage you to subscribe. We have lots of good stuff. 3 live webinars weekly. We mentioned over the podcast, so you can find us on Spotify, Apple Tunes, etc. So as Dr. Ballard and I were discussing early on, one of our most popular downloads was Perimenopause, The Journey to Menopause with Dr. Ballard from back in June. So I encourage you to go there, find that an excellent listen. But of course, the book, highly encourage you to get that. So till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.